Hello everyone, welcome to the channel JDC English. In this video, we're gonna start a new series. Not exactly starting a new series, but yeah, resuming that old series which we started. That is Target Pharma 360 degree. So in this lecture, we will study or examine the original previous year question of TNMRB. Okay, Tamil Nadu MRB. All right. So shift one. I'm taking shift one. So without wasting any time, let's get into it about the pharmacology and allied subjects. Okay. So how would you diagnose aplastic anemia? How would you diagnose the aplastic anemia, which has been asked TNMRB 2023? Yep. So is it bone marrow biopsy? Is it blood smear, spleen biopsy, or CBC? Aplastic anemia generally characterized with the agranulocytosis. 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 So generally, these granulocytes generally produce through bone marrow. So bone marrow biopsy should be done to diagnose the aplastic anemia. All right, guys. Yeah. So bone marrow depression on bone marrow result in granulocytopenia. That is agranulocytosis. Yeah, thrombocytopenia and aplastic anemia. The most serious toxicity. It is the most serious toxicity, often limits the dose that can be employed. Infections and bleeding are the usual complications. All right. So the dash are the receiving or input portions of a neuron. What is it? Chalo. Tell me, guys, what is the receiving or input portions of a neuron? Is it dendrites, axons, nucleus, or myelin sheath? What is it? Is it dendrite, axon, nucleus, or myelin? It is the dendrites. The dendrites are the things receive the receive the portions, receiving the input portions of a neuron. Okay, sure. Dendrites, the receiving part of the receiving part of the neuron. Okay, receiving part of the neurons. Sure. Vomiting center is located in. Vomiting center is located in. Specifically, the vomiting center is the CTZ center. CTZ, not receptor. It is a CTZ center. That is chemoreceptor triggering zone. Chemoreceptor triggering zone, and is particularly located inside the medulla, particularly inside the medulla. Okay, yeah, the vomiting center is situated bilaterally in medulla oblongata, where the nucleus tractus, near the nucleus tractus solitarius. Okay, stimulation of the vomiting center in the medulla oblongata results in vomiting. Okay, generally the rats and the mice, which are the rodents, do not have this chemoreceptor triggering zone. Okay, sure. QRS complex in ECG due to QRS complex is in ECG is due to ventricular depolarization, ventricular repolarization, arterial depolarization, or atrial repolarization. So let me make you understand there is a P wave, then QRS complex, and then T wave. Okay, then T wave. So P wave is generally responsible for atrial depolarization. Then QRS is responsible for ventricular repolarization, and the T wave is generally responsible for the ventricular ventricular repolarization, ventricular depolarization, and ventricular repolarization. Okay, so QRS complex is generally responsible for the ventricular depolarization. Okay, guys. Sure. Next question. So P wave, atrial depolarization, QRS complex, ventricular depolarization, T wave, ventricular repolarization. Okay, chalo. Duration of atrial diastole. Atrial diastole, that is the contraction time of the diastole. That is the filling of the atrial chamber. That is 0.1 second, 0.3 second, 0.7 second, 0.5 second. What is it? It is around 0.7 seconds. Okay. Yes. So atrial systole continues for about 0.1 seconds, 0.3 seconds for ventricular systole, continues for about 0.7 seconds for atrial diastole, and continues for 0.5 seconds for ventricular diastole. Okay. The type of collagen fibers present in the connective tissue of the tendon. The type of collagen fibers present The type of the collagen fibers present in the connective tissue of the tendon is type 1, type 2, type 3, or type 4. What is it? It is the type 1 collagen fiber. Okay, type 1 collagen fiber is generally present in the connective tissue of the tendon. Okay, sure. Yes. So type 1 collagen fiber is the most common type. The most common type and found inside the skin, tendons, and the ligaments. Okay. Tendons connects muscle to bone to muscle. Bone to muscle, whereas ligament connects the bone to bone. Okay, bone to bone. Type 2 collagen fiber is more elastic and the softer found in nose and ears. Okay. Type 3 is a found with type 1 collagen. That is kind of similar thing. Okay. And it is more elastic. It is found around blood vessels, muscles, and organs holding them together. Type 4 is a net that helps the body filter, such as the kidneys, and keep layer together under the skin. Okay. Sure. The most essential element required for the formation of thyroid hormone. Very simple and basic question. The most essential element required for the formation of thyroid hormone is calcium, iron, magnesium, or the iodine. Yep. So thyroid hormone, that is T3, which is triiodothyronine. Thyronine. So this ido only refers to the iodine. Yes. So iodine is the correct option, is the correct essential element required for the formation of thyroid hormone. Yes. Yes. So thyroid, the most essential treatment of the formation, essential element of the formation of thyroid hormone is iodine. The thyroid gland needs iodine to produce T4 and triiodothyronine, the two main thyroid hormones. The thyroid hormones are synthesized and stored in the thyroid follicles. The principal source of iodine is diet. Diet. Okay. Bioavailability is defined as the rate of drug distribution, rate of drug distribution, rate of drug absorption, rate of drug elimination, rate and extent of absorption. What is it? It is the rate and extent of the drug absorption. It is the rate and extent of the drug absorption inside the systemic circulation. Yes, yes. So bioavailability refers to the rate and extent of the absorption of a drug from a dosage from administered by any route, and it is determined by the concentration time curve in blood or by its excretion in urine. Okay, it is the measure of fraction F. It is denoted by F of an administered dose of a drug that reaches the systemic circulation in unchanged form. Antihypertensive drugs combination to be avoided except antihypertensive drug combinations to be avoided except amlodipine plus beta blocker, that is atenolol. Amlodipine plus beta blocker atenolol. Amlodipine is calcium channel blocker. Beta blocker is atenolol. Okay. Diltiazem is also a calcium channel blocker. That is atenolol. Okay. Methyl dopa and clonidine. Methyl dopa and clonidine. These both are the alpha 2 agonist. Agonist. Diuretic plus beta blocker atenolol. So which of the drug combinations to be avoided? Avoided except. That means which is which is which can be given. So which can be given out of these four, which of the combination can be given? Amlodipine plus beta blocker? Yes. So amlodipine plus beta blocker is a um, very much, I can say, the popular combination right now in the market that usually comes for the anti-hypertensive drugs. That is amlodipine plus beta blocker, atenolol. Okay, yes. Anti-hypertensive drugs to be avoided: an alpha or beta adrenergic blocker with clonidine. Apparent antagonism of clonidine action has been observed. Hydralazine with a DHP or prazosin because of similar pattern of hemodynamic action. ACE inhibitor with an ARB should also be avoided. Verapamil or diltiazem with beta blocker because there is a marked bradycardia. AV block can occur. Methyl dopa with clonidine or any two drugs of the same class. The drugs which are from two same class and two drugs are given should not be given, should be avoided. Beta blockers were directed because of the increased risk of developing diabetes. Okay. So, what type of biological characteristics can be predicted in paracetamol adverse drug causing hepatotoxicity? What kind of question it is? Question itself yelling the answer by its own. The question itself yelling the answer by its own. What kind of thing? The type A augmented reactions. Augmented reactions are the reactions which can be predicted, which can be predicted and dose dependent. Which can be predicted and dose dependent. Bizarre, chronic, end of use reactions. What is it? Augmented, bizarre, chronic, end of use. So, paracetamol particularly should be a dose. There should be a dose. So, 500 mg of the paracetamol causing the hepatotoxicity. That is a predicted form of adverse drug reaction. So type A, that is augmented reaction, will be the correct option. Okay, sure. The autocoid used for the abortion. Autocoid used for the abortion, that is histamine, 5-hydroxytryptamine, that is serotonin, prostaglandin, or platelet activating factor. What is it? Autocoids are the local hormones which generally synthesizes and shows its effect on the same site. They synthesized at the same site and there only they show their effects. So, particularly the prostaglandins, that is PGE1 is responsible for the induction of the abortion. Induction of the abortion. Okay, PGE1. Okay. So use of prostaglandin abortion facilitation, not only the absorption, not only the abortion. It is the facilitation of labor, cervical ripening, cervical priming. Okay. So these kind of things. Okay, chalo. Let's move on to the next question. The most effective drug for the treatment of migraine. The most effective drug for the treatment of migraine is ergotamine, promethazine, ondansetron, risperidone. What is it? It is the ergotamine, that is ergot alkaloid, that is derivative, ergot derivative. Okay, ergot is ergotamine. So, okay. Which of the following is a G protein coupled receptor? Very easy question. So, which of the following is a G protein coupled receptor? Muscarinic cholinergic receptor, nicotinic cholinergic receptor, glucocorticoid receptor, or insulin receptor? Muscarinic cholinergic receptor is the receptor which are generally GQ as well as the GI mediated. The odd ones, for example, M1, M3, and M5 are the GQ mediated coupled receptor, whereas GI having M2 and M4. Nicotinic are the ligand-gated ion channels. Glucocorticoid are the nuclear receptor. Insulin Insulin is a enzymatic receptor. Enzymatic receptor. Insulin receptor is a enzymatic receptor. Okay, so which of the following is a G protein coupled receptor? That is muscarinic cholinergic receptor. Okay, yes, heptahelical receptor, also known as the serpentine receptor. Yeah, largest family of the cell membrane. Yeah, have three subunits, that is alpha, beta, and gamma, heterotrimeric form. Yeah, different classes like GA, GQ, GO, GI 1213. GS is stimulatory, GI is inhibitory. Yeah. Okay. So, which of the following drugs is commonly administered by the intranasal route? Intranasal route. Which of the following drug is commonly administered by intranasal route? Chalo guys, tell me fast. What will be the correct option of this question? Which of the following drug is commonly administered by intranasal? That is the desmopressin. That is desmopressin, which is a antidepressant kind of drug. Antidepressant kind of drug. Okay, desmopressin. Okay, mucous membrane of nose absorbs the drug, bypasses gastric juices and liver. Example: GnRH agonist, calcitonin, and desmopressin. Okay, sure. Aspirin prolongs bleeding time by inhibiting the synthesis of aspirin prolongs bleeding time by inhibiting the synthesis of cyclic adenosine monophosphate in platelet, that is CAMP. Clotting factor in liver? No. Prostacyclin in vascular smooth muscles? Inhibiting? No. Thromboxane A2 in platelets? Thromboxane A2, that is TXA2. TXA2 inhibitor, that aspirin will block the or inhibit the TXA2 enzyme thromboxane in platelets so that there is will be the there will be the prolonged bleeding time. There will be a prolonged bleeding time. Okay. So generally thrombox A2 is formed through the arachidonic acid pathway, COX and LOX pathway. Thromboxane is generally produced from the COX pathway. Okay. Yeah. At high doses inhibits only TXA2 synthesis, 2 to 3 gram per day. Aspirin at low doses inhibits PGI2 as well as the TXA2. PGI2 is the prostacyclin. Prostacyclin. Okay. Yes. Sure. Which of the following drug is an angiotensin receptor blocker? Angiotensin receptor blocker. A RB, angiotensin receptor blocker. So all the sartan, the drugs which are having sartan as a suffix will be called as the ARB, angiotensin receptor blocker, which prevents angiotensin to bind onto the receptor of its own. Okay, so those drugs are known as the sartan. So among this, labetalol, lisinopril, losartan will be the correct option. Okay, chalo. Labetalol is a alpha plus beta blocker. Lisinopril is a ACE inhibitor. Yes or no? ACE inhibitor. And prazosin is a alpha 1 selective blocker. Okay, losartan. Chalo. The common side effect of the thyroid hormone is increase in basal metabolic rate, angina pectoris, nausea, or exophthalmos. What is it? It is the exophthalmos. The answer is the exophthalmos. Exophthalmos is a protrusion of eyeballs. Protrusion of eyeballs is called the exophthalmos. Mostly, but not all hyperthyroid patients develop some degree of protrusion of the eyeballs. Okay. Shall choose an emetic drug of central action: ipecacuanha derivative, promethazine, tropestrone, or apomorphine hydrochloride. I don't know. How easiest question will this be? Oh, so correct option will be Is it ipecacuanha? Is it ipecacuanha, promethazine, tropisterone, or apomorphine? Is it? It is the apomorphine because it is a derivative of morphine, and morphine is a centrally acting drug. So apomorphine hydrochloride is an emetic drug, not antiemetic drug. Emetic drug. Okay. Chalo. Apomorphine. Selective estrogen receptor modulator is flumazenil, tamoxifen, diazepam, or halothane. Hmm? Chalo. Selective estrogen receptor modulator is flumazenil, tamoxifen, diazepam, or halothane. So, tamoxifen is a selective estrogen receptor modulator. Selective estrogen receptor modulator. Flumazenil is a competitive inhibitor of benzodiazepines. Halothane is a general anesthetic. Okay, estrogen, yes, natural class. This one is a very important for you guys. This estrogen natural, estradiol and estradiol, synthetic means steroidal as well as the non-steroidal. Steroidal, ethinyl, estradiol, mestranol, and dibolone, diethylstilbestrol, hexosterol, or dinestrol. Anti-estrogen is the clomiphene citrate. Selective estrogen receptor downregulator, fulvestrant. Selective estrogen receptor modulator, it is the tamoxifen, raloxifene, and tormifen. Aromatase inhibitor, which are responsible for to convert the estrogen into testosterone, that is aromatase enzyme. And inhibitory of that is letrozole, anastrozole, and exemestane. Okay, so aromatase inhibitor, look, just right. So aromatase inhibitor is a letrozole. It is a letrozole, anastrozole, and exemestane. Ketamine is a general anesthetic. Aspirin is an NSAID. NSAID. Timolol is a beta 1 blocker. Beta 1 blocker. Beta 1 blocker, okay? Chalo. Hmm. Cotrimoxazole is a anti biotic of the sulfonamides class, and it is a combination of sulfamethoxazole and trimethoprim. But which part of sulfamethoxazole and which part of the trimethoprim consist of cotrimoxazole? Yes, so five parts of sulfamethoxazole and one part of the trimethoprim will be considered as the cotrimoxazole. Cotrimoxazole. Okay. Okay. Itself saying one, one, tree. Tree means tri. Trimethoprim. Trimethoprim. Okay. Chalo. Aminophylline. Aminophylline is a caffeine with ethylenediamine, theophylline plus etophylline, caffeine with etophylline, theophylline plus ethylene diamine. So it is a theophylline. It is a theophylline with plus ethylene diamine. Okay. Chalo. Adrenergic neuron blocker. Adrenergic neuron blocker. It is atenolol, atenolol, trazosine, methyl dopa, or guanethidine. So guanethidine is the correct option. That is the adrenergic neuron blocker. Adrenergic neuron blocker. Okay. Atenolol is a beta 1 receptor blocker. Trazosine is a alpha 1 receptor blocker. Alpha 2 agonist is methyl dopa. Okay. Sure. The main molecular target for alkylation in DNA by alkylating agent is the N7 of guanine. N7 of guanine. That is the base pair of N of the guanine, which is very important, guys. Very important. N7 of guanine is the main molecular target of for alkylation in DNA by alkylating agents. Okay, N7 position of the guanine, very important. Okay, chalo. Immunoglobulin and cytomegalovirus. Cytomegalovirus, immunoglobulin are administered by. These are the adverse effect. This one is the adverse effect of which route? Which route? Through intravenous. Through intravenous. Immunoglobulin and cytomegalovirus immunoglobulin are administered by intravenous route. Okay. L-SPA, that is L-asparaginase, is used to treat. L-asparaginase is an anti-cancer cancer enzyme which is generally used to treat the breast cancer, ovarian cancer, lymphoma, or acute lymphoblastic leukemia. It is for the acute lymphoblastic leukemia. Okay, so a state of rigidity of muscle fibers after death is called. A state of rigidity of muscle fibers after death is called. Is it atrophy? No. Rigor mortis, hypertrophy, or tetanus? Atrophy is decreasing in the size of cell. Hypertrophy is increase in the size of cell. Tetanus is an infection. Tetanus is an infection. But rigor mortis is the rigidity of muscle fiber after death is called, that is rigor mortis. Okay. Rigidity, rigor, rigid. Okay. Chalo. Rigor mortis. Okay. So we have this much questions. We do have only this much questions, that is 27 questions. A state of rigidity of muscle fibers after death is called the rigor mortis. So this is all about the questions we have for the pharmacology of the TNMRB 2023 shift 1. All right, guys, I hope I have made you clear around these MCQ. So prepare well for the next one and keep grinding yourself. Thank you so much.